Question number 1. Which of the following is the most abundant type of blood cells? Option A, thrombocyte. Option B, erythrocytes. Option C, lymphocytes. Option D, monocytes. And the answer is option B, erythrocytes. Question number 2. The process of tightening of the fibrin clot in such a way that the ruptured area of the blood vessel gets smaller and smaller, thus decreasing the hemorrhage, is called. Option A, fibrosity. Option B, fibrinolysis. Option C, synarthrosis. Option D, syneresis. And the answer is option D, syneresis. Syneresis means the contraction of a gel resulting in its separation from the liquid as a shrinkage of fibrin when blood clots. It means extraction of a liquid from a gel during contraction of clot. Question number 3. Function of an emergency drug epinephrine for a shock patient is: Option A, increased cardiac activity. Option B, improve consciousness. Option C, tachycardia. Option D, reduce cardiac output. And the answer is option A, increased cardiac activity. Adrenaline or epinephrine cause vasoconstriction mainly in arterioles of peripheral circulation is impaired. It also causes vasodilation into skeletal muscles, liver, and coronary arteries. And it increases cardiac activity also by increasing heart rate and force of contraction. Question number 4. Oxytocin mainly involves which of the following functions? Option A, motor skills. Option B, growth and mental ability. Option C, childbirth and lactation. Option D, regulation of blood pressure. And the answer is option C, childbirth and lactation. The functions of oxytocin are: during labor, it helps to expel the fetus by myometrial muscle contraction. It helps for transportation of sperms during intercourse. Stimulate contraction of breast tissue for milk ejection. It also acts as a chemical messenger in your brain and influences important elements of human behavior such as social recognition, relationship formation, and long-term emotional attachment. Question number 5. The symptoms of nephrotic syndrome are except: Option A, edema. Option B, hyperbilirubinemia. Option C, proteinuria. Option D, oliguria. And the answer is option B, hyperbilirubinemia. Nephrotic syndrome is a symptom complex appears by proteinuria due to glomerular capillary damage. It is characterized by massive loss protein through urine, severe generalized edema, oliguria, hypoalbuminemia, hyperlipidemia, and hypercoagulability.